Knee arthritis causes pain, stiffness, and disability in the knee joint. It can really make it difficult for patients to perform the activities that they enjoy doing in basic activities such as walking and stairs. If patients attempt non-surgical management with medications, injections, and physical therapy, and those don't alleviate the symptoms, then it might be time to pursue total knee replacement. In knee replacement surgery, we remove the arthritis from the ends of the femur and tibia bones, which make up the knee joint, and then replace the joint with metal and a piece of plastic. This entails a titanium piece of metal that goes on the end of the femur, a titanium metal tray that goes on top of the tibia, and then a piece of plastic that goes in between, and this makes a nice, smooth, gliding surface for the knee to function. Robotic knee replacement has been a technological advancement over the last several years, which has allowed us to improve the accuracy and outcomes of knee replacement. During robotic knee surgery, the patient's knee anatomy and alignment is mapped and registered with a robot. We then have a planning screen where we're able to make small fine-tune adjustments in where the components are going to go into the knee to provide a personalized and tailored approach to each individual patient's knee replacement. The goal of knee replacement is to provide a stable joint with a good range of motion that gets rid of the arthritis and the source of pain. I found that the robotic knee replacement allows me to achieve those goals less invasively, which hopefully allows the patients to recover faster from the procedure.